Call the meeting of the Fitchburg Commission on Aging to order today, January 11th, 2024. Our first order of business is approval of the minutes. Those were sent by Jill for the December 14th meeting. Any additions or corrections? If not, do we have a motion to approve?
Motion.
Second. Approve.
Okay, motion has been made and seconded. All in favor?
Aye.
Okay, the minutes have been approved. I understand there is a motion to amend the agenda.
Yeah, if we can move both of the resolutions up, and then Shannon from Dane County will present after the two resolutions are discussed for approval.
Okay. Are there any public appearances for non-agenda items?
No.
No? Okay, then first is the resolution for the Dane County contract for case management and nutrition services.
Yeah, Barb, let's make an official motion to amend the agenda.
Oh, sorry. All in favor of amending the agenda? Do we have a motion first to the agenda?
Well, I would move to approve the amended agenda as submitted by Jill.
There we go.
I second.
Is there a second?
Yep, second.
Yoder. Pam, sorry. I just used last names. Okay.
All those in favor of the amended agenda?
Aye.
Okay.
All right.
The motion passed. Then let's proceed with the resolution for the contract for case management and nutrition services.
Thank you, Barb, for doing that. Okay, so before you, well, it was in your packet and I do have it up on the screen. This is a normal yearly contract that we get with Dane County. This year, the total amount is $150,161. This money is to fund the nutrition and the case management program. And under the umbrella of case management is also MA case management. So you'll see this memo broken down into three categories. Nutrition funding is the $45,516, and that goes to help for administrative salaries, supplies, however we want to put that in our budget. Case management is $87,070. And then MA case management, how this works is they allocate money for that. This is billable money, so they've allowed us to bill the county up to $17,575 for MA case management. So that is reimbursable funds. It's not guaranteed money. Generally, we meet what they allocate us for. Some years we've gone over, and then we have to go back to the county to get an addendum to our contract to go ahead and bill. I did want to point out the highlighted below for the 2023 contract. In about October, I was notified that the county gave us too much money. And when they send this contract, as you can see, money is just put in nutrition, and it's put in case management, and it's put in MA case management. Well, what they did is they put in the My Meal, My Way money, which wasn't identified as that. It was just in nutrition, so I didn't catch it. And so as time went on, they caught it. So the My Meal, My Way was they gave you money up front to pay the restaurant when we went to Hy-Vee for any meals that we had eaten at Hy-Vee. So that money just rolled over into the next year, but again, they don't highlight it as My Meal, My Way. So the county didn't catch it, I didn't catch it, because every year we get an increase. So it just didn't it didn't trigger me at all that like, well, that's weird. So anyway, therefore by the end, so what I do is I bill the county quarterly, so then I couldn't bill them for the full amount the last quarter. So that was why I just wanted to highlight that, because then you can see our total county contract for 2023 was $129,600, and this year we are at $150,000. So a pretty big increase, and that's because they did give the POS agencies, purchase of service agencies, a cost of living increase. So that really helped. And then again, the more people we serve, it goes into the formula and the more funding we get. So that it's a boilerplate contract that we go through this every year. So just looking for a motion to approve.
Is there a motion to approve the additional funds?
The date.
And that, Jill, again, can you state what those monies are? 12,000?
Well, that was the money they took away last year, but the motion is to approve $150,000, $160 for our Dane County contract for nutrition case, MH case management.
Okay.
Was it 151?
It's 150, 161.
I make a motion.
Is there a motion to approve?
Okay, I make a motion to approve the Dane County Nutrition Program contract for $151,061.
Second.
Is it 150 or 151?
51.
No, 150, 161.
One.
Yeah.
Sorry, 150, 161.
Okay, thank you. Is there a second?
Second.
All those in favor?
Aye.
Any nays? Motion carries.
All right. So then the next resolution on there is, it's stated as a budget amendment for 2024 because that's what actually will happen if the Friends, when the Friends award the city money for the additional position. And so that's what that motion is about. In the memo that I've included, not just, this packet goes here, it goes to finance and then it goes to council. So there won't be a final discussion or approval until the 23rd. So you're the first committee to officially get this. Do you have a question?
No.
Oh, okay. So I just pointed out within this memo, right now Fitchburg's nutrition site manager position is 20 hours. If you look at a comparison with other focal points, you can see that we have the lowest hours allocated for the nutrition position because Mandy splits her time. And we're serving almost the fourth highest amount of meals on average. So we're up to 84 meals a day with home delivered and congregate. And you can see that there are other sites that serve lesser meals that have, DeForest has a full-time 40-hour-a-week case, our nutrition site manager with an average of 40. Now, some focal points are struggling getting their meals up after COVID. We have not struggled, for whatever reason. We all serve the same food, but our numbers came back up really quickly. We just saw we're putting together our annual report that we've served 2,000 more meals in 2023 than we did in 2022. So anyway, this was just some of the justification that I wanted to share with you guys, with the council, with finance, that, we are managing pretty well with this number of hours. And so thanks to the Friends to pilot, a 20-hour position in this year, whenever we can recruit for it. Misty, the finance, put together the list of all of the cost of that position. And so the Friends have allocated up to 25,000. At this point, we would only need 18,000 from them to fund a 20-hour nutrition assistant position. So that's.
So right now, Mandy is at least on paper, is spending 20 hours as a volunteer recruiter, developer,
Right, on
and then
paper.
20 hours on nutrition.
Right, but what we're finding is more is being spent on
So
nutrition.
Mandy would move to a full-time volunteer.
Not necessarily because, and Shannon, when you see Shannon's presentation about nutrition, you'll see all of the administrative things that go on behind the scene that Mandy will still have to
She'll
track.
supervise that.
Yes, and still have to do. So she'll take over a lot of the admin and I mean, she'll retain that work where a nutrition site assistant will come in and just do the day-to-day in the kitchen, making sure meals are going in and out, making sure they're temped properly,
Yeah,
that
yeah,
kind of stuff, so.
And this is for 1 year.
Just for 1 year. And there, that is, some of the discussion is what happens after a year. The city is obviously not going to commit to funding this position. I will say the position was in the budget too. I submitted in 2023, didn't get it. I submitted in 2024, it wasn't approved. I understand why, but I think that even if it doesn't get approved in 2025, having some extra staff available this year to do some major recruitment of volunteers, we already are starting to look at a 6th route for home delivered meals. That's not just one driver, that's like 5 drivers, every week, because they all don't take, week and week. So anyway, there's just a lot to do on the recruitment side that I'd like to see happen, that it keeps getting put down. The priority is less and less because the meal priority is more. So that's where we're at. Any questions?
You did a nice job of explaining that in detail last month as well.
Yeah.
That was very helpful in being prepared to support this today.
Okay.
Just one question, Joe, you mentioned that you're looking at adding on another route or something?
Yeah, for home delivered.
And so why is that?
So as the meals, as we get more people signed up for home delivered meals, the routes are so large and you can't have a driver, technically you can't have a driver out for more than an hour because that's against the standards of the program. And so you want to make the routes so they're manageable. So, we have Playcon that does a route and you want to keep it within an hour. It's a long time to be on the road delivering meals if you have to deliver 30 meals, and you usually don't. It ebbs and flows. But, we have routes that just go to the senior apartments on Chapel Valley. We have a route that goes to the countryside. We have a route that goes to west side of Madison. We have a route that just does Fish Hatchery. So now with the town of Madison, it's extended where we have to deliver meals. And so it's adding on time. So we're looking at adding on another route.
Jill, doesn't the time also have to do with food safety?
Yeah, and
The length of time that the food can be
right.
kept warm?
Right, yeah, and Shannon will touch upon that in her presentation too, so, yeah.
So the increase of volunteers is gonna be critical during this 1 year pilot period.
Correct, and that was, as I did get questions from city officials that, again, if you don't fund this, at least we have a year to breathe and really get a program in place that if we don't get those extra hours, we have more volunteers in place to hopefully, respond to the increase. I don't see it, it always has ebbed and flowed, meals, the number of meals we serve, but with the new apartments out there and, my goal to increase outreach and connections, this isn't gonna go away. And even it's not all about home delivered. Having people come in takes a lot of volunteers when they eat. If we're getting, not during a snowy day, but if we're averaging 26 to 30 on Monday, Wednesday, Friday, that's taking more volunteers. We used to be able to whip out, things with 1 or 2 volunteers in the kitchen. You could easily do that. But as you start to build the congregate program, that takes more volunteers as well, which means more supervision in the kitchen because there's a lot of questions that happen on a day-to-day basis. What containers should we put? What about this? So-and-so didn't show up. Should we send the meal? There's a lot going on in the mornings. Then it kind of quiets down in the afternoon. But so these are all my reasons.
Is there any further discussion? If not, do we have a motion to approve the budget amendment for the Senior Center LTE Nutrition Site Assistant?
I'll make a motion to approve.
Second.
Is there
And second.
all those in favor?
Aye.
Is there any nays? The motion passes.
All right. Thank you. All right.
Okay.
So again,
Next we have, okay, so,
I'm gonna let,
Bill?
I'm gonna let Shannon share her screen now.
Sounds great. I'll do that. Okay. Excellent. Everyone can see my screen and hear me okay?
Yeah.
Mhm.
Okay, great. Well, good morning, everyone. Thanks for having me. Very interesting to listen that the rest of your meeting is really about nutrition stuff. So I'm glad to be here. My name is Shannon Gabriel. I'm a registered dietitian and nutrition director for the Dane County Senior Nutrition Program. And just on the screen here, I always like to identify who I report to. And her name is Sarah Koenig. She's also a registered dietitian, and she is the state nutrition manager, of course, at the state level. So today I'm just going to give you a little background on the senior nutrition program, how we receive our funding and how we divvy that up at the AAA level. And then also what are all the roles within the senior nutrition program? How do we make this program work from start to finish? And who carries out those roles and all the tasks that are involved? I really want to make sure that you're aware of all the behind the scene tasks that Mandy is responsible for, because a lot of people think that a site coordinator is there serving the meals, they are organizing routes, and they're taking reservations for meals. And there's so much more to that. That is just such a tiny part, but that's really only the part that most people see. So just with the background, I like to really show the aging network and where all of the policies, procedures, and rulings come from. And this is where the money funnels down. So we start off with the U.S. Department of Health and Human Services. Under the Health and Human Services, we have the Administration of Community Living and Administration on Aging. Underneath them, we have the State Unit on Aging, and that's where my boss is at, Sarah. They're called BADR, the Bureau of Aging and Disability Resources. Underneath BADR, we have myself at the Area Agency on Aging of Dane County. And in Wisconsin, we have 3 AAA offices. We have Dane County, Milwaukee County, and what we call GWAR, Greater Wisconsin Agency on Aging Resources. And they actually oversee the entire rest of the state of Wisconsin other than Dane and Milwaukee. And then underneath the Area Agency on Aging's offices, we have our community partners or county tribal aging units. And our community partners are our focal points. So that would be Fitchburg Senior Center. So really, what is the AAA office of Dane County? The Area Agency on Aging, like I mentioned, we're one of 3 in Wisconsin. We support successful delivery of aging programs. So we have the nutrition program, which I manage. We have a caregiver program. We have case management programs and many other programs within our office. But we ensure state and federal Older American Act funding is used correctly. And we want to ensure that quality programs and services for older adults are produced from the funds that we're distributing. So this is always the famous question: how is senior nutrition program funded? And so this is a chart I used for another presentation towards the end of 2023. So I apologize, it's not updated for the entire 2023 year yet, but it is very accurate. So we had budgeted $2.7 million for Dane County's senior nutrition program. And of course, we went above that because of overutilization, increase in catering costs, and delivery costs. So when we're looking at the chart here, that 35% in the teal blue at the bottom, that is Older American Act funding that we get from the federal and state government. And then to the left is 15% is nutrition donations. And 15%, that's $428,000. So when we're saying, hey, you qualify for the program, we suggest a $4.50 donation, please pay only what you can afford, if anything. We brought in about $428,000 in donations. So that's a large chunk of money. 6% is federal USDA dollars. So again, more federal funding. And each state has the option to choose whether they want money reimbursement for each meal that we serve to eligible older adults, or if we want commodity foods. Back in the day, there was not a choice, and this is where we would receive blocks of cheese and processed meats. And thank goodness our state chooses to get the financial reimbursement instead of receiving those foods. So, for example, every meal that we serve to an eligible older adult, we receive about a 50 cent reimbursement per meal. So imagine, we receive all this other funding, but it costs approximately around $10 is the average for a catered meal here in Dane County. So we get a 50-cent reimbursement for each meal that we serve. 11% is our COVID ARPA funding. So this is rescue relief funding that has started during COVID, and 11% is $321,000, and that funding is going away after this year. 5% is additional potential funds needed, and I can tell you that it wasn't potential funds, we needed it. We did go over a budget at the end of the year. Anytime that I do need potential funds, this is where Dane County does step in and fill that hole for me. So we had an approximate need of $134,000, and that did come from Dane County funding. 4% is MCO meal income. MCO stands for Managed Care Organization. Those are insurance programs such as My Choice Wisconsin or iCare or Iris. And when we have individuals that are on these plans, we have a contract with these companies. So the senior center will serve them a meal, and then we actually charge full price for the meal to the insurance companies, and that is an income producing program that we have. So that brought in around $132,000 in 2023. And then 24% is county levy local funds. Those are all county funded dollars right there. Okay, so hopefully that explains where we get all of our funding from. So how is funding then divided among Dane County sites? So once we receive the money from state and federal and our program income, how do we then take that and distribute it among all the different sites that we work with? So we work with 12 focal points, Fitchburg being one of the 12, and we also work with SSM Health at Home. We have a contract with them. They serve all of our meals, all of our home delivered meals for the city of Madison and Monona. So in all of Dane County, we have 28 different dining or packaging sites for home delivered or congregate meals. So basically we have 13 different locations that we distribute funds to, and we distribute funds based on census information. So we take a look at the number of adults age 60 plus in the service area for that focal point that are food share eligible. They live in a rural community. They're minority population. They're age 65 plus and living alone. And then we also take a look at the number of meals that was served in the prior year. So we take all of this information, and the interesting thing about using the census data, so we're not just giving focal points funding based on the amount of adults that they served within the nutrition program that were in those categories. We're giving them funding based on just adults that are in these categories in their service area. They could be participating in the nutrition program or not, but we want to fund them in that way in case these adults do participate. So the last thing on this slide shows that we provide 3 hours of coordinator pay per day for each type of program that is at each site. So 3 hours of coordinator pay for a congregate meal, 3 hours of pay for a home delivered meal site, and Fitchburg does both. So they would get 6 hours of total coordinator pay per site. That being said, there's a formula that we use. We use this base pay. Fitchburg starts off with a 6 hour per day base pay for funding, and then we put the rest of the funding dollars through this calculation, this formula, looking at all the different adults that are served in Fitchburg, and then we come up with this number, this number of funds that we then give Fitchburg, and Fitchburg Senior Center then has to use that money to fund their coordinator, and then also fund additional costs of the nutrition program. We try to pay for most items through the nutrition program, but not everything. We don't include coffee anymore in our nutrition program. It's not a requirement. So that's something that Fitchburg has to pay on top of that. They might buy other different supplies that just make it easier on their end. So there are additional costs that Fitchburg needs those funds for in addition to paying for their coordinator. Right, so that's the funding piece. A little bit more about where we get our funds and who qualifies for the program. So our largest fund source is from the Older Americans Act. I call that OAA. This act began back in 1965. Pilot nutrition programs started in 1972, and across the nation, nutrition programs were all set in every state and between 1973 and 1974. We first started off with a congregate program, and then later on came home delivered meals. And the purpose of this act is to improve the quality of life for all older Americans by helping them to remain independent and productive. And the main point that I like to focus on is that last bullet point. We have to serve anyone that is age 60 or older. That is the main criteria for any Older American Act program. You have to be age 60 or older. There's a few caveats to that, but age 60. For the senior nutrition program, we do have target populations. So we do target lower income older adults that are from minority populations, living in rural areas, are socially and economically needy. But what I love about this program is that there's no income or asset test. Yes, we ask about income so that we can make sure we're targeting adults that are in a lower income bracket, but you can have any sort of income and participate in this program, come and socialize and have a good nutritious home cooked meal or have a meal delivered, and it doesn't matter what your income is. So that's something I really like about this program. And then also eligible participants must have the opportunity to contribute, but they cannot be charged a fee. So anytime you see information about the nutrition program, you'll see that in Dane County here, we suggest a $4.50 donation for a meal, but always please only contribute what you can afford. So we want to give that opportunity to contribute, but they can't be charged that fee, forced to pay that fee, or be refused a meal if they can't pay it. So what if you are under age 60 and you don't qualify? So let's say someone is age 58 and they went to the Hy-Vee Fitchburg meal site that used to be in operation. So at a My Meal My Way restaurant site, that's no big deal because they would come into the restaurant when we're having our senior meal there, and the restaurant would just give them the regular menu, and they have to purchase something off the regular menu, not our senior menu, at a suggested $4.50 donation cost. Because they aren't of age, they don't qualify for the program. But we have that happen a lot at the restaurant sites. We have someone that's age 50 come in with a friend that's over 60. They can dine together, but they can't have the suggested donation rate. At a typical dining site, like at the Fitchburg Senior Center, if I have someone age 58 come in, they do have to pay the full price, which at this year, 2024, it's $17.20 that they have to pay for the meal to a site coordinator. And you might think, who would want to pay that? And I also think that as well. But the state has a funding formula that we have to use to calculate what our non-eligible pricing is for the year. And the formula includes all of our catering costs, which is food, packaging, delivery of all the home delivered meals to the sites, site coordinator hourly wages. And then in the Focal Points expense report that they send to us, they might have costs in there that are mileage, rent, utilities, maintenance, insurance, professional fees, any of those fees that they pass on to Dane County as using to spend up the funds that they receive from us. We have to actually put that into this calculation. And to give you an idea, back in 2004, I was just looking at some old paperwork the other day. Back in 2004, our under age 60 rate was $5.30. Now, 20 years later, it's $17.20. So a big difference there. But it really makes sense because of the increase in food costs and the increase in labor and delivery and packaging. So that's where we're at today with the $17.20 meal cost. So then I always get the question, well, what if someone is really in need? We have someone that is vision impaired, they're coming into the senior center, they're age 58, can't they get a meal? Right now, with Dane County funding, they cannot. So the state of Wisconsin is not allowing any approval of waivers to allow non-eligible adults to participate in the program since 2020. So basically since COVID, because throughout the state, there are waiting lists that have started for the nutrition program. And these waiting lists are in effect because of lack of volunteers to deliver meals, to produce foods serve meals at the senior centers. They just do not have people coming in to help with the program. And there's not enough funding to pay for additional staff to make this happen. So anytime that there's wait lists throughout the state, we are not allowed to have waivers out there for individuals that are underage, even if there's so many other things going on in their life that they would benefit from a meal. We can't use our age 60 plus funds to provide them a meal. So anytime there's wait lists in the state, that equals insufficient funding. We cannot do any waivers for those that do not qualify. So really only eligible adults can use our program funding. Now there's different programs at all the different senior centers, all the different focal points. Some have charity funding where they may use different funds for someone to get a meal if they're underage. But that is very rare that we're using those funds. So senior nutrition program, you hear me talking a lot about congregate meals and home delivered meals. Each of these meals, whichever one you participate in, our purpose here with these meals is to reduce hunger, food insecurity, and malnutrition. We want to promote socialization of older adults with those congregate meals, and with that daily delivery of the home delivered meal, have that daily wellness check, and also to promote the health and well-being of older adults. So our congregate meal program, like I keep mentioning, age 60 or older to participate. This is where there's a few loopholes. So if you're a spouse who attends, if I'm 58 and I attend with my spouse who is 63, I can qualify because it's in the best interest of the older adult, of the 63-year-old, to have their spouse with them, to dine together, socialize. That spouse, underage spouse, can qualify. That's a federal guideline. If there's a disabled individual who resides at home with and accompanies the older adult to the dining center. So let's say I'm age 63, I have a disabled son at home that's age 40. I can bring my disabled son with me to the dining site and we would both be eligible because it's in the best interest of the older adult to be able to go out and socialize and bring my son with me. If we have a person that's under age 60 who is disabled and resides in a facility in which congregate services are provided. So we have one of these locations in Dane County, and that's at the Romness Apartment Complex in Madison. So we serve a meal at the Romness Apartment Complex, and about 65% of the adults in that apartment complex are older adults, age 60 plus, and the other percentage are disabled individuals that are under age 60, but they can all qualify because we serve the meal there, and that's a federal guideline as well. Under age 60 volunteers eat by donation only on the days that they volunteer, so they also qualify. And that always helps for getting volunteers in because they can get a meal on the day that they are serving the program. So here are all of our Dane County dining sites. So you can see right now we have 28 sites. We have some My Meal, My Way restaurant locations where we serve a meal at the restaurant on a certain day for a few hours. And then we have them at various community, senior centers. And then we also have in the upper right, you'll see Meals on Wheels. That's SSM Health at Home, which I said they serve all the meals for Madison and Monona, home delivered meals. So this is where Mandy's role comes in. So anyone that participates in our program, they can't just come in and just sit down and have a meal. We have to have information on them to make sure that they do qualify for the program. And we're a nutrition program, so we want to make sure and gather information on them to make sure that we're providing them with resources to make their nutrition and their health and wellness better. So every meal served must be tied to an eligible person. So we have to have them fill out this congregate assessment form, and that is Mandy's role. eligibility is determined upon completing an assessment form every year. We have to have an assessment form filled out once a year. So it's not just a one and done type of thing, every year. Congregate assessments are self-completed or with the guidance of the nutrition coordinator. So we have a lot of demographic information that we ask up here, make sure we're targeting our certain populations. We use this information for advocacy and to receive more funding. And then this right down here, this what's your nutrition risk? We are asking about their nutrition intake and their dental health, their ability to eat and prepare food. And this is a federal requirement right here that we have to ask these questions. On the back side of the form, one of the purposes of the nutrition program is to reduce risk of malnutrition. So we ask about that right here. And then we also want to reduce food insecurity, and we ask about those questions right here. Anytime someone is at risk for nutrition, malnutrition, or food insecurity, the site coordinator sees that information and then provides resources. So again, that's Mandy's role. Now moving on to home delivered meals. So people that are eligible for home delivered meals, again, age 60 plus and homebound. So homebound meaning, they're really not leaving the house except for appointments, or maybe someone picking them up to take them somewhere special. They are homebound. Also, someone else that can qualify is the spouse of the eligible person, if it's in the best interest of the homebound individual. So let's say my husband, age 80, is homebound. I'm age 59, and I normally wouldn't be eligible for a home delivered meal, but I'm cooking for him every single meal, and this would give me a break, and we could sit down and enjoy a meal together. So definitely, we would want to make sure that both people in the household are getting a meal, even though I'm age 59, I would qualify. And then also, again, disabled individual who resides with eligible individual in the household. So again, that example of if I'm age 65, I'm homebound, but I have a disabled son who's age 40, we can both qualify because it's in the best interest of my health. I don't want to get a home delivered meal and then still have to get up and cook a meal for my disabled son. It just makes sense that it's in the best interest of that adult. So here, home delivered meal assessment form, every meal served must be tied to an eligible person. So when someone calls up and says, I would like home delivered meals, Mandy asks them, Mandy or case management, depends on how they have that divvied up at Fitchburg, asks a few questions over the phone to make sure that they would qualify initially. Within 30 days, a case manager has to go into the home and do a home delivered meal assessment. So this again is to gather information, make sure we're giving them resources to help them remain independent in their home and improve their health and wellness. So again, every year this has to be done. It is a 7-page assessment. It is no small assessment. We're really trying to dig deep and get all the information that we need to know. The level of risk throughout the form, the nutrition questions that we ask comes up with a score, and that score determines how many meals they receive each week. So if they have a 6 or higher, they're determined to be at high nutrition risk, and they can get 5 meals per week. If they are not at high nutrition risk, but maybe they have they need a lot of help toileting, dressing, feeding. There's questions on here, are you able to prepare your meals? If there's other information on this form that really tells us the whole picture, the case manager can override that score and say, this person really needs that 5 meals per week. Or some people aren't at high nutrition risk, but just having a meal 2 or 3 days a week would really help them. And we have a prioritization system that we use to assign the number of meals to them based on their score. So again, once the case manager completes this form, then it's passed back to Mandy, the nutrition coordinator, and she takes all of this information and types it into our state database system. So everything that Mandy gets for congregate assessments, home delivered meal assessments, the number of meals that she's serving, home delivered or congregate, client's information, she has to then take that information from the paper forms and then put it all into the state database system, because then that's how I see it. And this is just another page of the assessment just to show you these in the right column here based on what the person says. So for example, I have an illness or condition that made me change the kind and or amount of food I eat, yes or no. Some additional questions they can ask here. But then these are all referrals. Can you refer them to a dietitian? Can you refer them to their healthcare provider? Can you refer them to the Stepping Up Your Nutrition class that I teach? Can you refer them to these other programs? More referrals. And this is what case management or Mandy does. So each nutrition program must follow the state policies outlined in Chapter 8 of the Wisconsin Aging Network Policy and Procedure Manual. So these are all the rules that the state office has me enforce. I have to make sure that all of our focal point providers are following all these rules. And we have to make sure that we're providing 5 days of food per week within the county area. We have to provide nutrition education to all adults that are participating in the program. So in Dane County here, we do that through placemats and nutrition newsletters. And Mandy has to ensure that this information is given out to all of her adults that are participating in the program. And then she has to actually log who received that nutrition education in the state database system. All food that we serve has to be served safely, sanitation-wise, and follow the Wisconsin Food Code. All meals that we serve have to follow the dietary guidelines for Americans. We have to ensure that every meal meets 1/3 of the dietary reference intake values. And then we also have to solicit feedback from the older adult community. We do this by having a nutrition and wellness committee. We have monthly meal comments that Mandy gathers from anyone eating a meal. She takes all of their comments, types them up in a report, and sends that to me so I can use that for future menu development. And then also we do surveys, which we just wrapped that up. So Mandy made sure that all congregate and home delivered meal folks that participate completed a state survey about what they think of the program. How's the food? How's the service? How has this program benefited you? So she's making sure that that's done and turned into me as well. So a little bit about why we serve what we serve. So every single meal, we need to make sure that it has a grain, 3 servings of produce, a serving of milk, has to have 3 ounces of protein, fats and oils. And then in Dane County, we require a dessert because we feel that it's a nutrition program, but it's also about enjoyment. So every week, here we go, every week of the menu, I have to make sure that we're serving a certain amount of dark green vegetables, red orange vegetables, beans, lentils, legumes, dried peas, and starchy vegetables because they have different nutrients. So a little bit about how I do that is when I have a master menu, this is the Wanakee master menu, I have to go through and make sure we have so many red orange vegetables throughout the week, so many starchy yellow vegetables, green vegetables, and beans are in this dark purple here. I also have to make sure I'm serving at least 3 servings of whole grain products out of the 5-day week. And so we make sure that every single meal we're meeting the daily requirements, but then every single week we're meeting the weekly requirements. This is very similar to a school lunch program and all the requirements that we have to meet in order to continue receiving the federal and state funding. So just an example here, these are the nutrient standards that I have to meet for a meal every single day. When we're serving a meal at lunch, I have to make sure every single meal meets these guidelines. And I do that by running a nutrition analysis on every single meal that we serve. The other thing that we consider when we're planning menus is how are we going to package that meal? And this is an awful picture of a meal on purpose where we didn't plan very well. It happens. We want to make sure that when we're planning meals, are we utilizing the tray compartments? Are we using too many baggies or additional dishes and bowls and cups? Does it transport well? We reduced to only having frozen desserts 1 time a week in the summer because of the heat and having the ice cream melt by the time we delivered it. We have to think of all those things when we serve a meal on site or when we have them home delivered. And this is an example of serving egg salad in a tray and stacked on top of each other. And that doesn't look very appealing once we get it to the homebound adult. So then next time we made sure to serve the egg salad in a little side dish instead. So it was a lot more appealing, but lesson learned there. So now additional options, in addition to just the regular entree that we serve, we have a no concentrated sweets option, which is a federal requirement. We have to have desserts that are either made with a sugar substitute, or it has to be a serving of fruit instead of the full sugar dessert if we offer dessert. We have to be able to offer a meatless option. This is not a federal requirement. We just do it in Dane County. So we always have a meatless option available every day. And then we are serving for Fitchburg area, we are serving entree salads 4 times a week, Monday through Friday or Monday through Thursday. So on a Monday, someone can either choose the regular entree, they can choose a meatless entree, or they can choose an entree salad. They have 3 choices. And then we have special holiday meals, traditional Thanksgiving meal in November, or sometimes just a special themed dessert like Valentine's Day type stuff. Jill, how am I doing on time?
I think okay.
Okay, all right. Okay, so here's just an example. One of our goals with senior nutrition is just serving tons of variety of foods. So most caterers that I work with will have, anywhere from 35 to 40 days of meals that we rotate through to try and try to avoid serving the same meals month to month. So just an example of an entire menu right here, and then how I categorize it to make sure we're serving nutritious food. Okay. So again, things that we have to do within the nutrition program that you might not notice, like I mentioned, the nutrition education, I make that, but then divvy it out to the focal points, and that's Mandy's responsibility to make sure all nutrition education is being done and logged in the state system. Mandy will also identify individuals that have nutrition concerns. They want to work with a dietitian. And this is also my nutrition counseling. I do provide that. It is a Older American Act program where I provide donation-based or free, if it's not in the budget, nutrition counseling services. And I do provide this by phone, Zoom, or home visits. Most often it is done by a home visit. And that's usually due to medication interactions with food. Number one reason that I'm consulted on for an appointment is typically new chronic health conditions. What type of eating plan do I follow based on this newly diagnosed health condition that I have? And then prediabetes and diabetes management. So this is really one of the biggest tasks for a site coordinator. Most of the sites that we work with are not commercial kitchens. So instead of having public health come in to do an inspection, I come in to do an inspection. I'm ServSafe certified, as well as Mandy and Jill. And we all make sure when you have that certification that you're serving food safely. And what I have to do once a year is I have to go to every site and do a safety sanitation inspection. And this is the form that I use. I have a couple of forms here that I'm going to show you, but it really details all of Mandy's roles as a site coordinator and what she's responsible for on a daily, weekly, quarterly basis. So of course, right up here, I'll go through it since the text is small here, but she has to be ServSafe certified, and she is. She has to make sure that all of her volunteers that are working with food, any volunteer that's working within the senior nutrition program, they are required, it's a federal requirement, that they have to have 6 hours of training that pertain to food safety and sanitation, fire safety, anything related to being at a meal site and serving a meal. So her volunteers have to have 6 hours of training. And who has to give that to them? Mandy does. So she has to come up with trainings and provide that to them. I don't come up with that for her. And Mandy does it in a really neat way. She actually spends an entire week per year on this process where she has volunteers come in for the entire day, several days throughout that week, and she gives presentations on food safety, sanitation, various different topics, how to do things in the kitchen there, how to work with guests in the program, and then she has specific sessions where they come into the kitchen then and they model that behavior and do it firsthand. So it's a really neat training program she does. Also, home delivered meal test trays. You guys were talking earlier about routes. Why do you have to add another route? And it's because we can't have routes that are too large, because we actually require sites to keep food within adequate temperatures for delivery. So all food has to be delivered and received at 140 degrees Fahrenheit or higher. So once that food leaves hot from the senior center, it has to get to every adult that's on that route at a safe temp. And we actually require that once a quarter. Mandy is doing a test tray. That tray rides on that route and comes back to the senior center. She has to temp it and make sure it's at adequate temp. So she's required to do that and keep those records for me. She also has to, make sure that all of her equipment is running properly, her fridge and freezer and ovens and steam table, her thermometers, and she has to keep records of that for me. And then keep all the temperatures of food and milk to make sure everything's cold enough or hot enough, so that if we have a report of someone getting sick, we can take a look back and see, well, was the chicken served at adequate temp? Yes, it was, and go from there. And then the other thing, anytime we're serving a meal in the dining room, getting that dining room set, that dining room is used for a lot of other programming. All the tables have to be cleaned and sanitized before anyone sits down. We have to have someone that's in the dish room doing the dishes and making sure that's done properly. She has to oversee her volunteers. Are they dressed appropriately for serving food? Are they wearing hairnets and aprons? Is everyone in good health that's in the kitchen? Are they using gloves? Also making sure that the environment in the kitchen is adequate to serve food there. Do we have a clean hand washing sink with soap and disposable towels? Do we have the appropriate serving utensils? Because from the caterer, that food comes and there's a certain portion size scoop that we have to use to make sure that we have enough food for everyone. All of these types of things. Also storage, we have to make sure that proper chemicals are being used and that she's mixing her cleaning solution and testing that to make sure that it's at the right parts per million. Also, so that's the on-site safety inspection stuff. Then I take a look at her records. I have to make sure she's doing her nutrition education at her site. Is she making sure to work with our managed care organizations to serve meals and reporting back how many meals are served so I can bill that insurance company at full price? Also, is she soliciting feedback? She has to send me a meal comment report. What do people think of the meals? We take that information and we use that to plan future menus, because that's a federal requirement that we have to plan menus based on our participants' feedback. And then, of course, I mentioned the volunteer training hours. She also has to complete nutrition monthly reports for me, which detail out how many meals were served for congregate, home delivered, how many donations did they receive for congregate and home delivered, and then how much waste did they have for the program this month? How many meals did she order from the caterer? And then how many meals did she serve? And she has to keep that at 1% or less. So just some of the information there. Let's see here. And then she just needs to make sure that this is pertaining to the assessment forms, really making sure that she understands that information, knows how to provide resources to the individual, and is serving an adequate number of meals. So this is just all the information that Mandy has to do behind the scenes other than just serving food and taking meal reservations and planning routes. Gosh, that was a lot of information, and I hope that was really helpful. But I wanted to make sure and leave a few minutes for questions if anyone had anything.
Yeah. Thank you for all of the information. That's quite a bit of information. A lot of policies, procedures, rules, and what have you. But I want to focus on your the donation portion of it, because that this program overall, federally, is to help food insecurities, people that are, hunger and whatever. And I know there's a lot of policies about age and money and what have you. There's a lot of people out there that don't have money, don't even have $4.50 for a meal, and a lot of those people that come to these sites, one meal a day is often what they get. And so my
Yes.
is, in regarding to donations, people come there, a lot of those people, they don't have money to donate, right? I mean, that's a reality. I mean, not like any of us sitting in this room, they don't have money. Nor in today's world, a lot of people don't walk around with cash money to donate as they come in. You have lunch and then you ask for a donation. Have you guys thought about stuff like that? I get, it concerns me that there's so many rules that can stop individuals that really need these meals in these sites. So those are just some of the things that stand out. I think you guys are doing a wonderful job, and it's a big job. And so don't get me wrong on that. But I am concerned with some of the people that don't have the ability, to either get to these sites or to donate to get a meal. But the guidelines often are so tight about not being able to get a meal. But that's one part of it. But the other question is, you have several different sites where people, should donate. Is there any way, is it, if I have a site that I gather a lot of donations, is there rewards for those sites? Or is there punishment for sites that come in week after week after week and don't have any donations? Is there anything with that? I'm just curious.
Nope, we just accept the donations back every month, and the only time I ever comment on a donation is if it's completely zero. I just want to make sure that it's actually zero, just to make sure that that's not an error in reporting. But there's no penalty, there's no rewards for having, above and beyond donations. It just goes right back into the program funding pot, and we use it to fund everything. So really, your comment about knowing that a lot of people don't have $4.50. That's actually why we always make sure that the donation box is off to the side. You can donate discreetly. At some sites, they choose to use little donation envelopes. So someone can walk in with a donation envelope that's empty and put it in, and you wouldn't know otherwise. So we have some sites where we get $0 for donations every single month. Some sites it averages out to be about 27 cents per meal that we serve. Other sites, it's $4 per meal, and we have a few that are above the $4.50. So it really varies at all the 28 different sites. But we realize that we don't want the $4.50 suggested donation to keep anyone from getting a meal. So we always have that tagline, but please only donate what you can afford. And some sites even say, if it's not in the budget, that's okay. So we are federally required that we have to have a suggested donation. And actually, ours is very reasonable. The only county that's below us at $4.50 is Milwaukee County. And I can't remember if I think they're at $3 for a suggested donation. But most counties throughout the state are up to $5, $6, $7 for a suggested donation. So we did actually just raise it last year to $4.50, and we were at $4 for quite a long time before that. But we never want that to get in the way, and we try and have the donation box off to the side just so people can, donate if they want to. We mention it. We have to mention it in all the newsletters and information when we talk about senior nutrition program. And they actually found way back in the day when they started this program that adults that came for a meal were offended that they were getting a free meal, and they wanted to be able to contribute. And so that's how this came about, that we allow them to contribute. We let them know what a helpful amount would be to contribute towards the meal, but only donate what you can afford. So hopefully that helps.
Specific areas that I don't doubt what you're saying, but there's specific areas that they wouldn't feel bad about getting they would welcome a free meal without a doubt. But are there coordinators? They aren't penalized in any way if their donation box comes in empty, right?
Nope.
Okay.
Not at all.
Okay.
And I would have to correct, I think Fitchburg, I think the entire senior center is so sensitive and cautious around that language that it is clearly, we will serve all, or that is my feeling as a meal deliverer. I think for both the congregate meals and the home delivered meals, it is quite clear that we serve all.
Yep.
And so that really should not be an issue for residents in.
That's me, sorry.
And I'm not speaking specific to Fitchburg. I'm talking overall for individuals outside of Fitchburg. Fitchburg is a different, in many, many ways, community. So we've got to be realistic about that, okay? And in terms of our population and what have you. But there are areas that they just don't. I mean, we have some people here in Fitchburg that come for the meals and they don't have the money to. Not that anybody at the center or around this table would say, oh, no, you can't have a meal.
No.
But there's something to be said about, there's policies and procedures and looking at food insecurities, but it's also about people insecurities as well. So there's impact on people, it's the impact on the center. So I'm just curious as to some of that, what's the impact overall on some of the centers, some of the coordinators, but there is also impact on individuals that come to these centers.
Well, and I have a comment to that, because I think it speaks to it. I think we are pretty unique. I mean, maybe not, I don't go to other meal sites, but I think we have some folks that can't afford and some folks that can't. And I think where we struggle is, say we have a big event, and there's a lot of new people, and for us to go out and say, hey, the donation is this, pay what you can afford. We always still have individuals that will come to us privately and say, I can't afford this, and they feel really uncomfortable. So oftentimes we tend not to say that, because you feel, you just don't want to make anybody feel bad about not donating. And I think that's some of the oddness that we try to, there are people that can afford, and we want to stress upon those folks that, if they saw that pie chart and how much those meals cost, and older American funding hasn't increased for 20 years, like, it's insane. And so, municipalities are picking up the cost, the counties are picking up the cost, the federal government is not. And, so it's nice to just make sure people do understand that $400,000 that Dane County collected is significant to make sure that the meal program lasts. So it's really upon us to try to get the message out without offending anyone, but also letting folks, if you can afford a donation, it really is important and critical to keep the program going. Particularly, I can see as we lose that ARPA funding, Shannon.
Exactly, yeah, that's a whole too. And one other thing I just wanted to note too is that with Senior Nutrition Program, you were actually allowed within the state of Wisconsin to have people use their SNAP funds, their food share funds, to donate towards the meal. But here in Dane County, we choose not to allow that, because we feel that if someone is food share eligible, they need those funds to use at the grocery store, and we do not. We want them to come to our meal and be able to get that free meal. So just an interesting point there too. There are a lot of counties throughout the state of Wisconsin that allow people to use their food share funds to donate to the program, and we've made that decision to enforce that. No, we do not want those funds. Use that for something else, and then come get our meal. So
makes a lot of sense. But has there been any discussion about the fact that in today's world, people don't walk around with a lot of cash in their pockets anymore?
yeah, there's actually some sites, not in Wisconsin yet, but in New York, they're already doing Venmo, which I'm like, that's genius. Venmo. I mean, we accept checks. We're not that tech savvy yet here in Wisconsin to do Venmo with our older adults, but I can see that would start to change eventually. But yeah, cash or check. Or sometimes people just pay for the month. They won't pay every time. They'll just put a check in every so often, and that's fine too. So.
Paul?
2 quick questions. Number one, first of all, a great presentation. I learned an awful lot here. I'm a meal driver. When we have inclement weather and we shut down and we can't provide those meals, what happens to those individuals who are signed up for 5 days a week and are at high risk? How do we do emergency runs?
Meals. Yeah, but I don't know if we sent out our emergency meals. And Dane County didn't give us boxes this year, did they, Shannon? The Friends, we go to the Friends usually, and then we ask for money to create emergency meals, and then we will send those home with clients. Mandy will go to Costco or Walmart, and then we have cans of soup, and so we have little bags that we'll send. The case managers will make sure that the home delivered meal clients have it, and then we also make sure the congregate, but I think we missed this week. We were not for this weather, but usually every year the Friends gives us a big chunk of money to go make our own emergency meal packets.
Good.
And how do they get delivered then?
Yeah.
Sometimes the home delivered meal folks will take them with their routes to say to the client, this is yours to save for a day that
Or
we're closed.
another day.
Yeah,
Okay.
and so
If you know
usually it's
something's coming.
your drivers that send those meals out, the emergency meals, but we did not do that for Monday.
I've never done that, but.
Yeah.
No, we
But the
haven't
other,
done-
the other observation I have is, I really got a lot of information on Mandy's workload.
Yes.
There's a lot behind.
And I'm wondering
Yes.
that as you look forward and you're looking at funding additional positions with the city council, I don't know,
Shannon would be a good one.
have they ever seen anything like this?
No,
I think they should,
yeah.
because I think that's ammunition for you as you go in there to try to make this one-year pilot program into
Right,
something that's
yes.
more
And I
permanent.
did feel really confident that the busyness, but I don't agree about having Shannon come to a committee of the whole to say, this is why, this is what you have to be educated about.
Yeah, this is eye-opening.
It is.
Thank you.
That's it.
I did have one question, Shannon, too, kind of back to the donations. Do you recall, and I don't know if this is still the case, because I don't know if we did it regularly, is that we were asked to send monthly letters home to clients to just say, you've received this many meals, if you were paying the full price, this is what it would cost, and then if you can donate. Are we still being asked to do that? Or,
You are. That's actually one of the last questions on the home delivered meal assessment form is if you, do you as a recipient of a home delivered meal, do you want a letter mailed to you every month detailing out how many meals you received times the suggested donation rate and what that donation rate, that donation amount would be for the meals you received this month? Do you want a letter that details that out for you so you know how much you could donate to the program? Or do you want that letter mailed to a son or daughter that maybe signed you up for these programs? Or do you not want to know it all and you can refuse to have that letter sent to you? So you have those three choices.
all right.
Is that a Dane County initiative?
No, this is a federal requirement that we always have to allow everyone to donate to the program, contribute to the program. So if it's a home delivered meal recipient, they're not seeing the senior nutrition program suggested donation sign that we have at the congregate site. It's up on the wall by the donation box. We have to notify them somehow of what the suggested donation rate is for the amount of meals they're receiving. But we have to offer that they can do a donation. If they refuse to get that letter, that's okay. We just check that box and we don't send them anything. So they have the choice. Sometimes people just want to know and they'll donate just whatever, $5 versus the suggested $50 for the month of meals. And that's okay. There is, again, no penalty.
Just curious to the drivers, do you find yourself getting a lot of donations when you?
Oh, it varies.
Occasionally.
There's one person on my route. Every week, she hands me three $1 bills.
Oh, that was, I saw that.
Every week.
I think we have the same person.
Oh.
And then there are a couple of other people that occasionally, they'll give me an envelope and a sealed envelope and ask me to deliver it to the center for
Okay.
them.
Yeah, I think we have the same.
Yeah, be clipped on the board, $3.
Yeah.
Yeah, I put it on Mandy's keyboard.
Yeah.
There it is.
We lock it up then.
So, and
I
obviously, there's a lot of work that Mandy, a lot of papers and stuff that she's filled out. So Jill, is there a summary of the surveys and stuff of?
The county
mean-
has those and then they share them with us when they're all compiled.
Yes, so we just actually completed a survey, received everything back by the end of 2023. Our department clerk is entering all the information into the state and we'll have results March or April of this year. And once I get that information, I present it all and give it to the focal points because we all use it for advocacy. And then we also use it for just improving program services.
And wouldn't you say, Shannon, those assessment forms have really got more complex over the years?
Oh, yes, yes, yeah.
Yeah.
It's like,
When I look back at forms, it was like name, date of birth, and 10 nutrition questions. And now it's so in-depth and it just keeps growing and growing. But it's because we have so many amazing programs and resources we want to make sure and connect them to. And we actually try to put the bare minimum on those forms. You should see some of the other counties' forms that are so extensive. They look like a book. But I think a 7-page home delivered meal assessment, that's quite lengthy. That takes a long time in home.
Shannon, is there, for individuals that, are not of age or can't participate in some of the programs that you described, is there any connection with the Salvation Armies or the shelters and stuff for meals and is there any connection there?
So no connection through me. So I would rely on my program providers, which would be Fitchburg Senior Center, that if they get someone calling in that would not qualify for our program, I would then, they would then refer them to other resources, food banks, pantries. If there's food that's coming into the senior center, I know you guys get Panera and Clausen's and, just hooking them up with other programs. So they would provide those resources on a local basis, better than I would at a Dane County level.
So Jill, do we have a lot of those referrals from?
If it's really, so with the county contract for case management nutrition, it's the same for case management. We technically aren't supposed to serve people under 60 for case management. Now we do because we are not 100% funded. And also too, because the funding for case management is county levy, it's not federal, so you don't have all of these other things attached. But if you want to talk about forms and the case management forms that we have to do for the county, that'll be another presentation. But if we have somebody underage, we have in the past, not recently, I remember asking the Friends to pay for somebody's meals to come to the center. This is before it was $17. They were under 60. In the past, we used to be able to get waivers. That's, I would say relatively new, that because we would ask for a waiver for somebody, but that's pretty new that we can't get waivers anymore. The Friends have made donations on the behalf, full price, for a client that's been under 60. If they have a lot of needs, we would refer them to the ADRC, where there might be other programs, managed care organizations that they would fall under. But sometimes it's difficult. I can tell you, we do collections for food pantries. We've been collecting food forever for food pantries, and we have volunteers that take it to Veg Prairie Needs Network or Ally Drive. If need be, we take food out of those collections and make a whole little food bag for folks, which we have done before. So, there are resources, but we don't delve in, well, I shouldn't say too deep for people under 60, but we do. But we can't feed them at the nutrition site, so we have to find alternative resources for them, and that is hard. The bus does take people to St. Vincent Food Pantry every Monday, although that's still troublesome because we're supposed to only take people over 60. And again, we used to be able to get waivers for the bus. I don't know for the food pantry, that would be something. It hasn't come up if we've had someone younger. It used to be when people were disabled, they could ride our bus here. But again, those were all the waivers that we used to be able to get. So things have changed. I don't know if that answers your question. We do our best. But there's not one place I can say, here, you're under 60, you can go and get a meal, buy a donation here. I don't know of any places like that. I don't think the Goodman Center, I don't know, I'm not aware of. Badger Prairie does lovely meals on the weekends that are open to the public, and they might do some evening meals as well. But oftentimes what you find is the transportation is a piece of that. Not only do they not, they can't afford a meal, they might not have transportation to get to Verona.
Oh, yeah, it's a lot.
It's all related.
A lot of stuff behind it, yeah. Shannon, you mentioned different sites, like nutrition sites where they can go to Hy-Vee or other restaurants, what have you. When that happens, how do you get that form that you said has to be filled out? Do they, at the restaurants, have them fill that form out?
They do. So just like at the senior center where Mandy is there, when we had the program at Fitchburg Hy-Vee, Mandy was either there at a table at the front with the forms for everyone to fill out, or oftentimes they had 2 trained volunteers that were sitting at a table and taking care of all the paperwork. So even at the restaurant sites, we have a donation box, a sign identifying us as the senior nutrition program. We have all of our paperwork for someone to fill out to make sure that they qualify for the program. And then we also have at the restaurants, we have specific menus. So at Hy-Vee, they couldn't just come in for our senior program and just order off the Hy-Vee menu. I worked with Hy-Vee and had we had like 8 choices to start off with that had all of those meal components, the grain, the protein, the 3 produce servings. it has to meet our federal guidelines. So we came up with our own individual menu for the senior program with Hy-Vee. That's how we do it at the other sites. We have like Fink's Cafe and Mount Horeb. So we have a special menu for the senior nutrition program of food that people can choose from that's all balanced. And then they fill out the form there.
That was gonna be my other question. But then, can you just tell, history-wise, how did you end up having nutrition sites at the restaurants versus at the senior centers?
So, yeah. So that started, I think it was before my time, 2014 or 2016, that my previous director who was in this role, she was thinking of her husband who was 6 years older than her, and that he said, I don't want to come to a senior center. I'm not old. And just they started thinking about people that don't want to come to a senior center, but maybe could benefit in some of these programs. And then we have a lot of adults that are eligible that don't want to be tied down by making a reservation 2 days in advance or a day in advance to get a catered meal at the senior center. So all these restaurant sites, they can just show up on the day that the meal's being served there during the time frame. They don't have to make a reservation. They're just going out to eat at that time. And then they grab the senior menu and sit down and have a meal. So it's for a lot of the adults that they don't envision themselves being of a certain age to be at a senior center. There's some stigma around that. And then there's also, we found it to be a benefit that once they go to these meal sites and the coordinator is there with all the programming that's happening at the sites, we can pull them in and show them how awesome everything is there. But then also, some people just like a lot of choice. They don't want, even though we're serving an entree, a meatless option, and a salad entree, it wasn't always like that. They want more choice. They want a restaurant meal. And so if they're going to go out, that's what they want. And so that really, that brought a lot of different people in than who we were just seeing at the senior centers. But those programs have been in action for, I think it's about 8 to 10 years already. And they're really nicely attended. It did not go well at Fitchburg Hy-Vee, but it was primarily because of Hy-Vee, and they just didn't have the staff to serve us and keep the meal program open. So
Also found that when we switched, the folks that were coming for lunch regularly on the bus were choosing not to go to Hy-Vee. And that was our target. For me, that was a lot of our target population. And the feedback was, I miss being able to sit at a table with my friends because the booths are really high and there wasn't not a lot of space for people to socialize, and they were really missing that. And so we saw our Wednesday numbers at the senior center at that time be about 20 people. And at Hy-Vee, those same bus riders, it would be 2 or 3. And so while we did see a few new faces that we hadn't seen before come to the center, I really was watching our target population, more of the frail, low-income folks that came on the bus that were choosing not to go to Hy-Vee. We thought, oh, this is great. They'll have a restaurant meal,
Right.
get out, they've got transportation, but it was the complete opposite. They stopped.
Not a benefit for every site. Yeah, for sure. It's
Just
different all the way around.
piloted it for about 6 months, and it wasn't worth it. And all the stuff that Mandy would have to pack up, and we'd have a table and all the Sam's forms, and you would sit there for 3 hours, and so it wasn't that successful.
Another Mandy responsibility.
Yeah, right. Yeah, shoot.
Yeah, that's right.
It was, we gave it a good run. So anyway.
So it was Hy-Vee the only restaurant, and are we not doing anything outside of senior center?
Hy-Vee
in
was the only
Fitchburg?
restaurant. I don't know. See, it really wasn't up to us to find the restaurant. Hy-Vee was just kind of chosen. They did Whitney Way, the Whitney Way one, the East Side, and Fitchburg, and that was the options. Yeah, I see.
Yeah, that's why it really started in Fitchburg, because we had Hy-Vee other locations open throughout Madison, and it was like, why not have the Fitchburg Hy-Vee one open as well? But then Hy-Vee restaurants closed for business. So that's really why we did that program.
Yeah.
So, but we do have other restaurant locations throughout Dane County. We have Fink's Cafe in Mount Horeb. We have DeForest Family Restaurant in DeForest. We have Riverville Bar and Grill in Belleville. And then we also have Kavanaugh's Esquire Club in East Madison.
What about, so Ziggy's closed? Is that right?
Ziggy's closed for business at the end of the year.
That was
They were supposed to have a buyer and it just fell through, so.
they were pretty popular. Ziggy's in Oregon, that was their My Meal, My Way.
Yes, everyone loved their barbecue, for sure.
I heard that. So, anyway. All right, any other questions for Shannon?
No, that's been extremely informative.
Yeah. So thank you.
Good, thank you. Thanks for having me.
Yeah, thank you for your time, Shannon.
You're welcome. Bye, everyone.
Bye.
All right.
Okay. That was a very informative and helpful report. I think we all learned a lot. So thank you for arranging that, Jill.
Well,
Next,
let me just give the credit to Janice. She's like, you gotta get some people at these meetings. I understand. So I appreciate Janice. And I was like, well, this is a good time to have a nutrition. You know, and I have so much of this in my head, I forget how much others don't know that I really do know. And so, so anyway, it was a good presentation, and even I learned new things or am reminded of things, so.
And the last couple, they've been great.
Right,
They've been
yeah,
great.
so we'll probably take a break next month, but I will continue to bring speakers to really give you some more insight about what does happen behind the scenes, because there's a lot going on, particularly our connection with Dane County. It does add a level of work. Verona Senior Center many years ago broke away from the county because of all of this paperwork and compliance, and they were lucky enough that the city picked up the funding for their nutrition. So they now contract with their own nutrition, TNT catering, and they asked for a donation, but the city does pick up the cost of their nutrition site coordinator. They picked it all up. And also for case management, they don't get any county funds. But not being connected, you do lose a lot of opportunity to learn about resources and connections and be part of a bigger piece of the puzzle. So anyway, okay.
It's big. It's a lot of
It's a lot.
red tape and
A lot of red
rules
tape,
and
lot.
policies and
That's
yeah,
right.
it's a lot.
Yes, yeah, so, all right. Okay, Barb.
okay, next is a report from the Senior Center Friends.
Okay,
We have a
Oh, Jerry.
I'm Jim Kelly, and my apologies for being late, but anyway, over the last month or so, the Senior Center Friends have developed a schedule for events for 2024. We are arranging a travel show with Mayflower on February 7th. And that will include an in-person representative. We kind of held their feet to the fire because it works out so much better having somebody there to interact with more personally. April 21st, which is a Sunday, we're having a pancake breakfast, which we resumed doing last year, and we're quite successful with it. We're doing that again this year. And on August 16th, which is a Friday, we're going to be hosting a brat lunch like we had a couple of years ago. So we've got those events lined up and committees developing programs for each of them. Over the last month, we've made a couple of donations to the Fitchburg Senior Center, some funding or reimbursement for the Fitchburg Singers for a performance that they put on recently. And we've donated $150 for bingo prizes for the next several months. And other than that, Jill, have you had a chance to talk about your meal ticket program yet? Okay, but anyway, we will be supporting that, but financially. And that's the extent of the Fitchburg Senior Center Friends activities, at least that we'll share.
Want to thank them publicly for their generosity and the support that they give to the center. And, you know, again, when I went to them about this pilot position, well, you can ask, you know, and then I leave, and they're just so generous, and I'm really grateful to have such good friends. Really, really, really lucky. I feel really lucky. Go ahead, Janice.
That's a good question. And the three events, those are like fundraisers? Is that your fundraisers for the year or something?
Yes, the travel show kind of develops into fundraisers in that people who sign up for the various trips with Mayflower, then we get a reimbursement from that. And also the other two are fundraising events, yes.
So just a quick question, and again, I realize that Fitchburg is a different community here, but what's the demographics? You know, I know you guys take trips, you do a lot of great, wonderful things. What's the demographics? Any people of color on your travels and your pancake? And, you know, I mean, what's it like? I mean, what's...
A few. Percentages, it's probably pretty low, certainly less than 10%, probably less than 5%, but certainly these events are open to all, and you know, they're welcome to come here. The brat lunch thing is pretty much somewhat of a localized activity in that a lot of the people who work around here will come here, they'll grab a brat, and being a Friday at noontime or so, a lot of them may not make it back to work. They might just, you know, have a brat and a beer and then head for home, something like that.
Kind of like the Brat Fest, a smaller Brat Fest kind of thing.
Are we
Basically,
having
yes.
beer? I heard rotten beer.
Well, we serve beer at this event. Anyway, so, you know, that would reflect the demographics of the local community, a very localized community here to a certain extent.
Yeah, okay.
Pancake breakfast, we've had people from quite a lot larger area, and I think perhaps with that, we might have had a few more people of color at that event rather than more so than the lunch and the Mayflower presentations.
What's the date on the pancake? What did you say?
April 21st.
I think also diverse age groups at the pancake breakfast.
It's what?
Diverse age groups,
We
families.
see a lot of families now.
Yeah, a lot of families there. The brat lunch is a lot of, I would say younger people, but most people are younger than I am. You know, people who work for a living stop there for lunch or on the way home type of thing. So anyway, in terms of the age range, yeah, the Mayflower travel is pretty much older folks, but the other two events are very much for the a wider age range.
Okay. I'm just curious. I mean, you guys do a lot of really great things, so was just curious about demographics.
That's it.
Thank you, Jerry. The director's report?
Okay, I'm just gonna run down some stuff I want to talk about. We're already working on Celebrate Black History Month. And again, Janice is helping me on this. And I think it's gonna be great. It's a film by Dr. Charles Taylor called Leaders of Madison's Black Renaissance, and I did watch this last year. You can pull it up on YouTube, and it's a fascinating film about Black leaders in Madison over the years, covering all kind of areas. And then Dr. Taylor will be here also to answer any questions after. So it's on Friday, February 16th. It's going to be a movie-style theater in the Oak Hall Room. We'll show the film, which is about an hour 45, and then Dr. Taylor will be around to answer any questions. So trying to get a lot of publicity out about this. Again, I thought the film was amazing. It was really interesting. So working on that. You have anything to add, Janice?
Yeah, Dr. Taylor was a previous professor for Edgewood College, and he's been in the Madison area for many, many years. He's an author, and he does a lot of documentaries, but a really, really great guy, really great guy. I think.
Yeah, so we hope to get a good.
Yeah, and there's a lot of, in that documentary, a lot of individuals in the Madison area and what have you, that, you know, maybe many of you might even, you know and have interacted with. So hopefully that you'll come and join us for that event.
Yeah, and it's open. We're gonna do a lot of publicity on it. So let's see what else. Oh, the tickets that Jerry mentioned. didn't bring a sample today, but I have, I created like a little ticket, and it's just, what it is our goal is to increase our outreach. I mean, continue to increase our outreach. There's just so many new people here in Fitchburg, so many new apartments. We need to do better on West Verona Road. And so it's sort of like a, come and join us. And here's a ticket for a free lunch. Because we're not supposed to say lunch is free. You know, we try to avoid that because of the donation piece of it. And so it's a kind of a fun, cute little ticket, and then for each ticket, so the caseworkers they'll get a stack of them because it's kind of through their outreach. Not that I can't give them away either, but that they're really going out and identifying people that are not coming to the center, maybe aren't aware of it, just haven't come yet, and just a way to encourage them to come. And then those tickets then will be given to the friends like on a monthly basis, and they'll make a donation to the meal program. So again, very appreciative of the friends, you know, because I can't go out there and promote free lunch, but you know, it's nice to be able to say, hey, come on in, and then you can, you know, tell them a little bit more about the program. So we'll be kicking that off hopefully next week. I'll make all those tickets up and try to encourage folks to come. So that's that. Otherwise, just, you know, just kind of back at it with programs, and that's fine. Nothing new there. Janice is going to lead the staff through a SWOT analysis in February. Strengths. Janice works harder than I do. I'm just going to say it right on film. What is it? Strengths, weaknesses, opportunities, and threats. And so we're going to go through all of our programming. I think, you know, I always like to reflect last year, and then I kind of like to let it go and start fresh. We really offered a lot. We might have saturated our offerings. So it's just a lot. And I think coming back from COVID and seeing people come, and I get excited, and Dave gets excited, and somebody else hasn't, you know, we just love it. I just love it, you know, and I want to be everything to everybody. And then all of a sudden, come April, you're just fried. And then September, you don't even want to have your job anymore because you just did too much. And then January, I'm just back at it again. So the SWOT is coming at a good time because I'm just so fired up about the new year. And you know, I have a goal digger on my desk, you know, not gold, but goal, because I love goals and I love doing everything related to just trying to make improvements. So the SWOT analysis will keep those guardrails up so I don't go, you know, kind of over the cliff like I usually do. I'm working on trying to figure out, and you guys think about this, is this transportation money. I now have $7,200 to work with. And I am struggling as to how I can stretch this money throughout the year. And I have done a lot of research. I've talked to Madison Cab, I've talked to Union Cab, I've looked at Uber, I've looked at Transit Solutions, Capital Express. Do we charter? Do we do individual rides? Do we do on demand? Do we do special events? You know, something like all of these fundraisers that we've never been able to have transportation for. You know, we set aside some money to make sure everybody can come to the pancake breakfast. You know, the brat lunch if it's after hours. You know, so there's certain special events that I want to set money aside for. But then there's also these on demand, like somebody just this week, well, it got canceled because of the snow, but there was 2 women that wanted to attend a program that went until 2:30 that didn't have transportation. Well, that could be a quick on demand Uber ride, cab, whatever. And so just trying to really, you know, gather all these details, and then, you know, I have to also work with the city and how we finance it, because if you just give a contract of $7,200 to a bus company, well, that's a little different. It has to go through a lot of the city procedures of, you know, it's over the $5,000 mark. You have to get maybe 3 different quotes from different bus companies. Buses to charter that are like 15 passenger, 14 passenger, like the one that comes for lunch, that's about $90 to $95 an hour. So those are the going rates that I'm trying to figure out. You know, cabs, a little less expensive, but don't carry as many people. So I think the city might be open to us doing all kind of things. I don't have to give a contract to just one person, but so a lot of details to work out yet. I think the first event will be this Black History Month to make sure that those that want to stay can stay and have a ride home. So I want to get my ducks in a row sooner than later. So anyway, just doing a lot of thinking and researching about that transportation. So anyway, doing that. We have some money from the capital improvement plan that was awarded this year to replace some tables and chairs upstairs. So Dave and the rec department are working on that. We do have our Spanish group still meeting on Mondays. It's not getting off the ground very quickly because Christmas we were closed, New Year's we were closed, Martin Luther King were closed. And so, I think at the most we had 3 Hispanic speaking folks and then the facilitators. So still kind of working on that and hoping if we get this position, Mandy can dive in a little deeper with the mortgage center, that we can bring some students up to help with some programming and things like that, and then start to schedule some Spanish speaking programs. So then we get more people to come. So working on that. And then let's see, on next Tuesday, I'm going to go and do a presentation to the faith leaders group. So the city brought that back after COVID, where we would meet with area faith leaders and just share information about what we're all doing. And so I was asked to present, and I'm really happy about that. So we can share information about the senior center, get more support from the churches, and also too to let them know what's available, so they can then refer folks here, for different programs and services. So working on PowerPoint for that. And then I'll just quickly mention that reaccreditation is due, state reaccreditation is due this year. It won't be too intense, so I'll be looking to form a committee for that. And then also this is called the Toolkit for Inclusion, and it's senior serving organizations. It's specific for senior centers. It's a great guide, toolkit, I guess is what it is called. And that is something that I want to get through this year, so I'll be looking for committee members to serve on this as well. And then working on goals. Now, for the first time, the mayor has reached out to all committee, commission, board presidents to meet with them individually to see what their committee goals are for their department that they represent. I can tell you that I've been working on my goals that will come here, and I'd like for you guys to give some thought too about, the direction of the senior center and some focus that you'd like to see, commission be involved in for 2024. But my goals are simple. I mean, the accreditation is a goal. It's not too bad now that it's a reaccreditation and they've changed it, but just really looking at all. I think, Paul, you were on it. Barb's been on it at least once or twice. Breaking down different areas of the center, from policy to marketing to building and grounds and staff and evaluation, and just making sure that it's just a good time to look at your stuff and make sure that we're doing what we need to do to stay accredited. The inclusion toolkit I want to get through this year. And then I have some really specific goals for outreach, both within the senior apartments and also on the west side of Madison, to increase people of color. Not just us serving, but also to participating and volunteering. I would say Janice gets the award for being our only person of color that is volunteering at the center, and I need to do better to reach out because we do have some diversity, and I think it would be nice if we had RSVP drivers of color, if we had people in the kitchen helping. So just a lot. So those are just my first goals. And then after the SWAT, I'll probably have some different goals. Yeah. But also too, I welcome and you guys' input. It's nice to help somebody guide me, because again, I tend to go off the rails and just get in my own world and do what I won't need to do.
In the best of ways.
In the best, I have, it's the best interest in mind, but sometimes, over promising and trying to be everything to everybody.
You're thinking is what you're doing.
I'm always thinking. I'm always thinking. Yeah, so good things coming this year. I feel I'm always excited about the new year. So anyway, next month we will be talking about goals, because Jim then will meet with the mayor about what our goals are. So I'll forward you my SMART goals so you guys have an idea. And then we can go into that in February. So no speaker, but just more time to kind of just chat about that and the direction we're heading this year. So that's all I got.
Well, thank you, Jill. Our next meeting is February 8th. Are there any other announcements? No? If not, do I have a motion to adjourn?
So moved.
Second.
All in favor?
Aye.
Any nays? We are adjourned. Thank you.
Thanks,
Thank
Barb, for
you.
running the meeting.
Oh, yeah. A little difficult remotely, but it's always a challenge.